Provided I find my pen lights, you'll have pen lights to work with. If not, there'll be a marker or a pen of some sort laying on the table for you. Okay? So, but here, we're checking for symmetry. We're going to inspect the conjunctiva. We're going to assess extraocular movement. And you're going to assess pupil dilation and accommodation. So again, I'm looking at my patient's eyes. I'm making sure they're even and nice and symmetrical. I'm making sure the brows are nice and symmetrical. One's not higher or lower than the other. And then I want to take my pen light, all right, and I want to check for their pupil dilation, right? So I would turn my pen light on. The pen lights, see how this has a little hook right there? Like the little hook on a pocket. To use the pen light, you push that, okay? So pretend I have a light. All right, I'm gonna stand a few inches from my patient and I'm just going to turn my light on and go in and out. Come to the other side, in and out. And I'm making sure that their pupils do dilate, okay? Dilate and constrict according to the light. Then I'm looking for extraocular movements. I'm looking for accommodation. You're gonna have them, tell them to follow your pen. Stand about 10, 12 inches away from them, making sure that they don't move their neck, all right? Their head or their neck, they're only gonna be using their eyes, all right? And we're just kind of gonna go on an H, all right? So have them follow it to the side, up, down, back to the middle, come over, up, down, back to the middle, and straight in, all right? Do not poke them, all right? You don't need to get that close. Once you just pop right there, it's good. All right, so be careful with that. So all I did was make an H. All right, and then go in. All right, so I'm also, not only was I looking at their pupils, I was looking for any extraocular movement, like nystagmus. What is that? Anybody know what that is? Sometimes the eyes will look like they're just jiggling, you know, so you're watching that as you're doing their movements. You're making sure that it's nice, the eyes should be nice and smoothly watching their head. It shouldn't be jumping all over the place or getting stuck or anything like that, okay? Also in this part, we're gonna inspect the conjunctiva. So again, you'll have hand sanitizer. So, well, hopefully one that works. All you're gonna do here is we're gonna look at the pink of the eye. We're also looking at the whites of the eyes. We want to make sure that the whites of the eyes are nice and white. There's no yellow or discoloration, no discharge. We're gonna take our thumb pads and we're gonna gently pull down on the bottom of the eye, have them look up as we do that. And we're looking at the pink part. We want to make sure it's nice and pink, that it's not red or inflamed, and make sure there's no discharge or anything like that. Okay? Clear about the eyes? Okay? So to get all that right, that's another 18 points.